For staying with TVC Breakfast. Now to the next half, or the second half of this edition of TVC Breakfast, and it's time to talk about climate change. It's still one of the biggest challenges facing the world today, and in a disturbing report by the World Health Organization, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress alone, this between the years 2030 and 2015. The 54th annual meeting of the World Economic Forum is tagged Rebuilding Trust, and it aims to restore faith amidst multifaceted global challenges, with leaders all over the world on board to discuss this challenge. And one of the prominent issues that's to be addressed is that of disease X, which is reported to be deadlier than COVID-19. And so these are some of the issues that we will be talking about during this next round of discussions, especially as the WEF, that's a World Economic Forum, continues. The 2024 edition continues, and we have in the studio with us public health expert and publisher Health Nika Tui Mibaondu. Dr. Tui, it's good to see you. Happy New Year.
Good morning. Happy New Year.
Happy New Year.
Can we still say Happy New Year after?
It's the third week.
It's okay.
First time I'm seeing you this year.
Okay, Happy New Year. Happy New Year. Nice to see you.
Oh, fabulous. All right, but this is a concerning twist. Of course, we've been living with, climate change. We've been talking about climate change. But now with this latest statistics of millions at risk of death, it goes without saying that climate change is indeed a health issue. Or how do you see it?
Climate change is the biggest threat to health as we see it now. Of course, we know how climate change comes up. There are a lot of greenhouse gases, carbon dioxide, methane, nitrous oxide, that actually trap or blanket the whole atmosphere into heat. So leading to rise in temperature. When the temperature rises, natural disaster, the water surface rises, cyclones, tornadoes, storms, crop failures, extreme droughts, extreme of weather, and then of course the vectors of diseases now keep growing. Even in places where malaria has been eradicated, come back, dengue fever is coming, schistosomiasis is there, Chagas diseases, a lot of diseases are coming, and then we're seeing a kind of resilient diseases coming and challenging the whole world. And it has been estimated that, of course, by 2050, we're going to see like 12.5 million extra deaths because of climate change. We're going to lose about $14.5 trillion to climate effect on health. So big issues at COP28. It was nice enough that we were able to bring health and climate together and have a serious discussion on it for the first time. But again now, at WEF 54, this is the 54th edition of the World Economic Forum, we have seen a situation where now we have to bring, again, climate and health together. Climate is, like I said, climate is the biggest threat to health situation of the whole world. Because the after effect, we will not be able to cope with it. We saw what COVID did to us. We're trying to learn from COVID, and then we cannot allow another pathogen, either a known pathogen mutating and becoming an epidemic threat, or a new pathogen coming in and becoming an epidemic threat, threatening livelihood, threatening existence, threatening world peace.
Well, this is the global leaders, they're talking on the global stage about how all of these things is going to affect, the entire world. But then if we try to bring it down, domesticate this conversation to Nigeria, well, the weather is even confusing. I remember I was talking about this, when you came in, talking about how much the heat is really, causing some sort of discomfort. The author of this particular report, which is being discussed at WEF, analyzed 6 consequences of climate change, said floods, droughts, heat waves, tropical storms, forest fires, and rising sea levels. Which of these, is closest to us, and how does it really affect us?
Again, the closest to us are actually the extreme weather, both droughts and flooding. Of course, we saw what flooding did to Nigeria, how we had a lot of loss of crops, challenged health system because of flooding, the rising cases of cholera, and even the waterborne diseases. Okay, those are really, really very close to us. The second thing that actually we get from climate change is that a lot of crop failure. You know, we have a twin thing happening to us now, insecurity, that is preventing people from farming, and then again now we're having climate change that's actually making the growth of those crops very challenging. Of course, what do you get with this? Shortage of food supply, malnutrition. Nigeria is number one now. Of course, you know that there are more than 35 million severely malnourished children in Nigeria, which is a huge issue. Now, if you look at that and figure out that the level of poverty in Nigeria, because this thing is actually intertwined, the level of poverty, climate change is further promoting poverty, climate change is promoting crop failure, and leading to all sorts of health challenges. And of course, you see recurrence of cholera, recurrence of Lassa fever, because when the heat comes, the rats move away from their normal abode to try to, encroach into the human environment. Also, the humans also move to their abode in a way, and then we see transmission of vector-borne diseases or even animal-borne diseases to human. So, in a multifaceted way, we're being affected. But I hope we're really discussing this. I hope we're really interrogating this. I hope we're really preparing, honestly, for the effect of climate change on health.
Especially since, Africa harbors, so many vulnerable societies, and, Nigeria is not left out. What are you seeing on ground, to see that we have indeed learned our lessons? I mean, thankfully, despite the negative projections for COVID-19's incursion into Africa, into Nigeria, considerably, at least when you compare the impact with, those abroad, people say Nigeria, was still better off, so to speak. But, can we, whatever happened or whatever formed the basis for how we didn't have such a big impact, can it be said, of climate change now, or our institutions improving?
No, institution is improving. Let us not, again, you cannot be lucky all the time. Sometimes you are lucky, but you can't be lucky all the time. Because, you see, you can't base a health system on luck, okay? Now, because for you to have that kind of resilience that will be able to allow you to respond to a threat, to an epidemic threat, of course, first you need money. Okay, you need a copious amount of money. You saw what happened during the COVID, but for the World Bank that actually moved money to Nigeria to buy a lot of materials, it would have been a lot of more mess, right. Even including vaccines. Then still, you need the surveillance, the detection mechanisms. When you're talking about surveillance, you're able to pick any disease before it occurs at all. Before those germs jump from anywhere to humans, you need that. And then you need true laboratory to make this happen. Human resources, of course, it will be a tired repeat if I start talking about challenges of human resources for health in Nigeria. We're not having them. Of course, the other time the president was saying that we'll train more. It's not going to work. I mean, let's get that straight. It's not going to work. Retain them. To train, because we want to train people, you need qualified people to train them. They're not here. The capacity of our ability to train people is just about 3,000 medical doctors, for instance, per annum, and none of them run away. So we must be able to retain. It's not just you train and retain. That's the key thing that's going to change us. And then we have to really escalate the discussion, because, wait a minute, the political will must be there to address challenges of climate change and health. We must be put in the front burner. Yes, we're having a lot of problems. If you look at those priority diseases that, the pathogens the WHO is looking at, quite a lot of them are in Africa. Lassa, Ebola, even COVID also is also in Africa. Caribbean, Congo, hemorrhagic fever is in Nigeria. Zika, came from South America, is also, entering the country. All those diseases that are actually big pathogen threats. And then now we have a new one we call disease X. That becomes a big issue again, because now disease X is a disease that you're still wondering what is it exactly.
What it is.
Exactly. And of course, some people have raised money for disease X. Some people have actually started making vaccine for disease X. So it's a big issue. We are not just in the conversation. Let's be frank.
But we attend this global, meets. This current Web Forum that we're talking about is even, the Nigerian contingent is there, headed by the Vice President. I wonder whether, like Ibrahim said, is it that we just go there for these programs? What happens when we come back? Why isn't it easy for us to replicate or to take or begin to accomplish these resolutions that we are part of?
If you look at the big stage at this Web 2054, Nigeria is talking more about public-private partnership.
Right.
The key issues, they're not focusing on it. Nigeria is not talking about the level of poverty. Nigeria is not talking about the disparity in health system, because even the climate change is going to affect us the more. It's going to affect us, the global south, the more, and the poor, the worst. Okay? Because when you burn fossil fuel, what happens is that, you see, even if you put carbon taxes, it's going to affect those poor people the more. Okay? So Nigeria is not, our focus right now in any public or international forum is actually to ask for foreign direct investment, is to ask for public-private partnership. But there are core fundamental issues on which all this foreign direct investment stands on. You cannot be having pandemic in your country repeatedly and your health system broken up and you expect me to come and invest in that country. Okay? So let us discuss that fundamentals first. And even if you're not discussing at that global stage, which you should, of course, because that's your chance, you should be able to come home and raise critical panel on discussing that. For us, what we have now is actually primary healthcare and community engagement to discuss some of these critical health issues. Now, if you're talking about disease X, it's going to be strange to a lot of Nigerians. And of course, it's raising a lot of dust all over the world that what is disease X? Of course, we knew what we went through with the COVID. People were not happy with COVID. They were not happy with the lockdown. They were not happy with the censorship. They were not happy with the vaccine mandates. A lot of issues came up with that COVID. But when you're now trying to create disease X, people will now raise that and they were going to revolt. But I was thinking that, at the level of WHO and World Economic Forum, what they'll be looking at is how to ensure appropriate preparedness for the next pathogen. That means jump from anywhere to humans. By labeling disease X, of course, you know how this thing came to be, 2017 here. Professor Woolhouse and his group from Edinburgh University brought this disease and said, WHO, include this disease X. What is disease X? It's a hypothetical disease which we don't know yet. Okay? But you're already making vaccines, you're already raising up to 1.5 billion for disease X. Okay? So, but we in Nigeria were so constrained, we're so overburdened. There's
the existing
all issues burden on that. In reality, we cannot sit down and look strategically and focus on our health. And once you don't strategically think about your healthcare delivery, and you cannot link health and development, you are not working. I'm sorry.
You mentioned disease X, and I kept wondering in my mind, based on what people really ask about questions, regarding COVID-19, saying that it's just a laboratory test, trying to make Africans or some other people guinea pigs to test out some of these things. How do you react to some of this? I don't know whether it is fake news or misinformation. I'm not sure whether you got the question. Talking about the origin of COVID-19, you mentioned disease X now. Maybe it's just a laboratory sort of.
Right. You were here during the COVID.
Yeah.
Nearly every day, we try to debunk misinformation, disinformation, and weaponization of information. Right. Perpetually, it was very tiring, very challenging, because the narrative has been set and it was ongoing. So now, the lesson, because the key thing is rebuilding trust. Rebuilding trust. Now, what trust have you built from COVID-19 before we start talking about disease X? That's right. Can we be trusted? I'm talking about to WHO now. Can we be trusted? So again, you have to reassure people that what you are doing, because I don't know why you have to label it disease X.
Yeah,
Just simple. The simple thing is that, preparation, for the next epidemic, should we have it? So that we won't have lockdown, so that we won't have vaccine mandate, so that we won't have all those things, closing schools, businesses. I think we are not, I don't think tagging a disease X, whether hypothetical or real, it is a good way to rebuild trust. I was expecting WHO to discuss sincerely those gaps in communication during COVID and not then come back and start thinking about the next disease. And of course, when you see those people that are contributing to the money to this disease X, of course, it's a PPP thing. You see, those governments now, they are even the big polluters.
That's right.
You know, USA, what's it called, European Union, Japan, Germany, Australia. These are the contributors, you know. And then the private part of it is that, you know, CEPI, funded by Bill Gates, is contributing huge money to it. Wellcome Trust is contributing big money to it. And these are the guys that were leading manufacturer of mRNA vaccines, okay? So I think that in a world, it doesn't point to step back and look at our communication, how people perceive us. It is important because communication is an emotion.
So that puts a question, you know, the World Economic Forum, you know, the credibility of that forum itself, because, you know, a lot of people believe that it doesn't make the world a better place, even though they claim it for themselves that, you know, it make a better place, because, you know, some of these, you know, multi-stakeholders endeavors, you know, have democratic deficits, so much so that the countries that are affected do not, you know, take, you know, prominent parts or prominent decisions in some of these processes in achieving some of these results.
You've actually hit the nail on the head, because, you know, because the reality is this. If you look at the discussion, because I take my time to be part and parcel of it. Essentially, you see this, the Global South is actually excluded from World Economic Forum. What voice is Africa, or did Africa, or does Africa have in World Economic Forum? And if you see the invitation, of course, they have about 60 head of state. Presently, there are 300 people from different areas. You ask yourself, where is Africa in this equation? That's right. Okay? And then how are the decisions, the past decision, how is it impacting on Africa? Now, you know, you come and told us that the world has about 320 trillion debt. Okay? And then disproportionately, the debt is affecting Africa more, whereas the Western world are having a lot of enjoyment in using those debts. But here, the debt is a burden onto us, and it's crippling every innovation we're trying to do. So, like Riley said, we have to actually interrogate and query what economic forum, how wide is the economic forum you are talking about?
How relevant?
And then, what are you really doing exactly? Okay, for instance, when COVID came and affected a lot of us, what economic forum, what did you do? Okay? So it's not just talk shops. It's just a talk shop. People gather together. People that influencers who want to define the next agenda gather together and start telling us this is what you do, this is what you should not do. I think, honestly, the most painful aspect of this is that, you know, Nigerians are very intelligent. We saw what South Africa did when it trying to talk about ICC and all those stuff. Right. That is debatable. But again, they raised their voice, and it made a lot of difference to reduce the level of carnage going on in Gaza. But Nigeria should be able to stand firm and articulate things. What economic over what? Which is not affecting us. We're in debt. We're having challenges about currency. You know, we cannot manufacture. You know, these guys, they're the greatest polluter in this world, are the big manufacturer.
But does Nigeria, Dr. Tuyi, apologies I interrupted, but does Nigeria have that moral ground to, you know, be more assertive on international platforms as this? You've just reeled out, you know, some obvious challenges, you know, facing the Nigerian government. And then you've also said that we are here. One of the primary reasons why we are on these platforms is to seek more investments. And of course, there is also the issue of donor fatigue and all of that. But if we have to be more assertive, as you expect us to be, do we have that, do we have the credentials to do that?
We have the credentials. Listen, don't let narratives, because, you know, a lot of things, we know that the whole world is about mind manipulation. The whole media is about mind manipulation. Now,
Except TVC.
If you want to crop the negativities in a lot of these countries, from America to anywhere, you'll be shocked that Nigeria is also not too bad. But again, the narrative has always been driven by certain people to put us in that kind of category. Yeah. And then,
we also
fall into it.
That's right.
We fall into it and parrot their narratives, which is actually quite challenging. So
yeah, because they control the global media.
Indeed, the global media is being controlled by them.
Right.
The global economy is being controlled by them. If they say it's World Economic Forum, you have to accept it's World Economic Forum. And it's actually a kind of NGO in a way, aggregating people. But the question is that, what have you done for us lately? What have you done for the whole world lately? It's beyond just going together, gather everybody together to talk and creating disease X and putting all sort of trying to, put fear into the mind of people again. Prepare for epidemics, the next epidemic or the next pandemic. It's a clear-cut statement. How do you prepare? Political will, finance, surveillance, response. How do we, that is what we're talking about. Don't label, in fact, the next epidemic will actually be, drug abuse. That's right. That could be the next epidemic. It may not even be a virus, it may not even need a vaccine. So again, you cannot just tell me that the next epidemic is good. Yes, I know that pathogens do jump from animals to human. We agree. And we are looking at a multi-sectorial way to deal with that. But you cannot, the next epidemic may not even be a virus. It may be an epidemic of drug abuse. So, but for us, we must be able to sit down and define our own next challenge, health-wise. It's not, because health is local. You understand?
And you're saying that being a local, thing now, being a local system, so to speak, or a local battle or warfare, we still need the international community, but you're saying, but not on the terms with which we are currently playing.
Yeah, we say, because, why health is such an international thing is because if you don't control it, it can jump to the next place. Yes, it's a collaboration, okay? It's not a dictatorial thing that thou shalt do this. That is my own point, okay? And then, for instance, we look at our data and figure out that malnutrition is causing a lot of problems for us. Climate change is worsening this malnutrition. Insecurity is worsening the malnutrition. Our children are not going to school because of this malnutrition. They cannot perform better. We figure out, guys, what food do you have? How do we grow our food? How do we distribute our food? How do we make, security, food security in each household? We look at that and we tidy it. We look at simple infection because we're not having water. We tend to see a lot of cholera. Flooding is worsening the situation because when flooding comes, it also brings germs along. Apart from injuries and miseries and all those things, because we know that is also a climate challenge. We said, okay, how do we relate in terms of our own Anthropocene activities? What do we do? So, of course, now it's not that the World Economic Forum is pledging for us, massive investment in solar or wind or alternative energy to help reduce the burning of fossil fuel, coal, oil, and gas, okay? It's not that they're doing that for us. But, of course, they just talk, people move around, discuss among themselves, everybody goes home, and then next year, it's another WEF 55. Right. So, it is for us to understand the policies. But again, do we have the lever, the fervor to be able to assertive in some things?
And you say we have?
We have. We have, because again, we have, first and foremost, you are important in the world stage. Don't underestimate Nigeria. Both as a country, as a geopolitical structure, and then as both individually, there's a lot Nigeria can do. Okay? But the energy is being divided to fighting on social media over irrelevant things. Okay,
so looking at the after effects of all of these climate change on the world economy, and then bringing it down to Nigeria, PricewaterhouseCoopers survey finds 45% of CEOs say that they must adapt or die. But the question is, what kind of adaptation and coping mechanism can be introduced, especially to our own climate?
In terms of climate, the climate change?
For individuals and businesses.
Now, tell you what, we are not the great polluters in this world. Now, I've mentioned that more than 76% of the CO2 emissions, methane and nitrous oxide, we know them. They are the big manufacturer, China, USA, European Union. These are the guys polluting the world. How many industries do we have except churches? You understand? Which industry do we have in Nigeria? So for us, either you look at the carbon taxes as an incentive for us. We, raise the increase the carbon tax, send the money to us, and then we now tell you that, okay, don't worry, we can seed production to you. If that is not happening, we must produce. Because there are gaps. You know, here, there are a lot of things in the country that we don't have. We are not producing. Recently, one of the biggest syringes and needles manufacturing concern in Nigeria closed down because of inclement environment, whatever reasons.
For business.
So, again, now, when this disease comes again, we have to use syringes and needles. We have to use gloves. We have to use face masks. And then we will not be dependent on India to ration and donate to us.
That's right.
How long can we continue with that? We have to manufacture first. Our own contribution to climate change is minimal. If they don't want us to do that, send money to us. The carbon tax, that was benefit from it.
That's why, do you agree with the president when he said at the time, you know, during the electionary period, that when he said that the world should not tell us what to do, that we know what to do about, you know, they should not, you know, begin to tell us how we can fight our own climate change, because climate effect, but they are the major polluters, they are the one, but then we will take it in our own strides.
Indeed, we cannot throw away their suggestion. It's actually negotiation. You sit down from a level of higher reasoning that, okay, guys, these are the things we're facing. These are the condition of my country. Look at my country, look at level poverty level, look at the unemployment level, look at hunger, look at this. I have to produce. Or how do you want me to deal with all this problem? But there are other activities that's actually worse, especially the one that you have to, you know, clearing bushes, burning bushes. Those ones at our level, we can reduce. Because there's no way you should just, you know, start burning bushes, cutting trees recklessly. We can reduce that and start, you know, creating an environment, you know, that will be homely, you know, to human where trees are allowed to grow. That we can plant more trees. That we can, you know, at the level of the desert, you know, which is one of the big climate challenge, we can start putting trees in those regards. But when it comes to manufacturing, we're not polluting anything. Nigeria is not there.
But, okay, so there is, you know, an urgent battle at hand. And the fearsome thing about climate change is that it's really out of control. You really cannot control it. But everybody is on or are on all fours that we need to build resilience in our health systems, especially in Nigeria. But, you know, I don't know, what do you think? How do we get there? How can we just, you know, break past these levels? You've just given us a bit of some of the current health concerns that we have, amidst the fact that there is massive brain drain in our health institutions in Nigeria. And of course, drugs are increasingly becoming expensive and
produce.
And all of that. Production, of course, and all these things are interwoven. But what quick fix can we get, you know, from your observations?
It's obvious. You see, the quick fix is obvious. Don't let, first and foremost, you have, now I think the number of primary health cases has increased now. We have more than 30,000, just 8,000 of them are working. How do you explain that? Okay? Now, I think each community, every person in this nation, it's not a big deal because we all have NIN number, though it's not helping in the terrorist fight. But we have NIN number, whatever number it is. This number can be linked to a primary health care center. We have to maximize, we have to engage the community and communicate. The low-hanging fruit we have now is proper communication through the primary health care center by trying to look at our diseases, and then we figure out how to train and retain, you know, our health workforce. You know, again, it's going to be a huge challenge that somebody, you know, relocate and try to build a health system and is kidnapped on the road, and somebody's crowdsourcing, what's it called? You know, so deal with that security. But as far as health security is concerned, maximize your primary health care center. Right. Dispense communication appropriately. Let people know the early warning signs of diseases, those relating to climate, those relating to anything. You know, communicate in those small languages that people understand.
All right.
You know, localize it and involve the community leaders. The KBSs and the emirs should not be just going to Abuja to collect contract. They should communicate health.
All right.
I mean, honestly, they should communicate it. What's difficult in that? The pastor should not be doing just miracle. They should communicate health.
All right. It's a
with
fine
that miracle. I mean, that's the good starting point.
A fine place
don't think about it. It has to be a big
conversation.
hospital. No.
All right.
No, that's not the starting point.
Thanks a lot for all these insights. Always a delight speaking with you, public health expert, publisher Health Leaker, Dr. Tuyemi Baodu. Thanks again. Many thanks.
Thank you. Nice.
All right. Coming up on TVC Breakfast, United